Hello, everybody, and welcome to our webinar on Türkiye-Syria earthquake, establishing effective community-based complaint mechanisms from the Safeguarding Resource and Support Hub. My name is Heather Sonia Üner, and I serve as the RSH National Representative for Türkiye. Welcome. I'm so glad you're here today. Before we start, a few points on housekeeping. First, you are all on mute with your videos turned off. This is to support the quality and connection of the webinar. Please be aware that we will be recording this webinar to share on the online hub afterwards for anyone who was not able to join. Your names will not be visible. This webinar is available in English, Turkish, and Arabic. To change the language, please choose from the settings bar at the bottom of the Zoom page. You need to make sure you have selected mute original audio to clearly hear the interpretation. Closed captions are also available in English. Please select these from the control panel if required. Please also be advised that this webinar contains content on safeguarding that some may find distressing, especially as we will be discussing the events and the aftermath of the very painful earthquake in this region. The chat is open if you would like to share your name and organization. Panelists will be sharing links to relevant resources and are available to support with any technical issues you may have. If you would like to ask any questions during the live Q&A session, please add them to the Q&A function throughout the webinar. And you can add Q&A in the control panels on the bottom of your screen. You can add new questions or upvote any existing questions. We will try to cluster them in order to answer as many of them as possible. We have also put the info email for the hub in the chat. Please do write us if you have any follow-up questions or need any more information. At the end of this webinar, we will share a poll live on screen for feedback on today's webinar. Please do complete this. It's very helpful for us. Okay. In today's webinar, we aim to explore the underlying structures needed for establishing a community-based complaints mechanism, or CBCM. What CBCM looks like or can look like in the context of the Türkiye-Syria earthquakes disaster, as well as best international practices. Our overarching goal is to provide listeners with information they can take back and use in their own practices and programming in their own local communities. Today, I am joined by two wonderful guest speakers who are ready to share with us from their wealth and knowledge and experience. I am delighted to introduce our first panelist, Andrea Watkins, the RSH Technical Director. Andrea has an impressive background in social care and child protection, which supplies her with extensive experience in providing technical assistance, investigations, training, and capacity building, policy development, and institutional learning. She holds a master's degree in social work from the University of Michigan and has since worked across the UK, Middle East, and Sub-Saharan Africa. Welcome, Andrea. Next, we are graced with the presence of Seda Nazal, who has been working for United Nations Population Fund as the Accountability to the Affected Populations Consultant since 2021. Prior to her work at UNFPA, she worked with International Organization for Migration as the Communications and Visibility Consultant, in addition to her extensive leadership in programming roles throughout Turkey. She holds a master's degree from Bilkent University in Media and Visual Studies. Next slide, please. Next slide, please. So to get started, we'll just have a quick look at today's agenda. Our overarching goal here is to gain a deeper understanding of community-based complaints mechanisms in practice, because this improves safety and the well-being of people engaged in our programming who are able to voice concerns and complaints. And this provides vital information to help practitioners build and maintain robust community-based complaint mechanisms, both for prevention of and response to safeguarding misconduct. And some of the objectives we have for today's webinar are to introduce some key definitions and concepts to you, look at what causes vulnerability, and touch on the links to safeguarding. Reflect on the current circumstances and challenges for non-governmental organizations wishing to establish or improve their own community-based complaint mechanisms. I am sure this presentation will bring about a rich discussion, and we are excited to hear your questions from our listeners at the end of this webinar. Now let's get started with Andrea, please.
Thank you. Thank you, Heather. It's great to be here with you to talk about such an important topic. So move to the next slide, please, and we'll get started. So what is a community-based complaint mechanism? And we will refer to it across this webinar as CBCM, as we've heard already. So essentially, it's a way for an organization to receive feedback, complaints, or even compliments from community members, and to ensure that responses are delivered in a timely, confidential, and impartial manner. It's important to note that feedback or complaints can come to an organization on a wide range of topics, not limited to program services or activities, but it could also include feedback or compliments or concerns raised about fraud, corruption, or sexual exploitation, abuse, and harassment. So it's something to just really think about when thinking about a CBCM. Is a wide range of issues which could come through it. And what really needs to underpin the model is that it needs to be safe, it must be transparent, and it has to be accessible. The channels and pathways that are embedded in the CBCM must work for all, particularly for community members, in order for it to be effective. Next slide, please. So we'll discuss some key components of building a CBCM. And I think the first most important one is consultation. A lot of times as an organization, and I've seen it in my career, where they will just go off well-meaning, well-intended in creating CBCMs and a whole wide range of referral pathways and feedback mechanisms, and they have oftentimes skipped out or minimized the consultation phase. So this is really, really important when thinking about how to build or how to construct a CBCM that works well, that is efficient, that is safe and accessible. So the consultation needs to have input from a wide range of stakeholders and across a range of internal and external partners. And we'll talk more about the internal consultation because that is often missed out as well. So across the CSO or across an organization, there'll be many different aspects that comprise the organization. So there's normally your programs teams, your evaluation, your MEL teams, or the people, the colleagues who will be responsible for delivering those activities. And they need to be involved. They need to be consulted when building a CBCM. Community engagement efforts are really, really important, as well as consultation with implementing partners of whom there may be one, none, or there could be many. Your finance and audit colleagues definitely need to be involved and express feedback about what will work for them, in terms of how they can have buy-in and how they can be involved in the CBCM, and as well as human resource colleagues. So that internal buy-in and engagement and consultation is very, very important, because what we've just learned on the previous slide, the range of feedback that could come via a CBCM could touch on each area of the organization's work across all of these areas. So if you've built a CBCM and you haven't included your internal stakeholders, you're really missing a vital part of how to make this work and how to secure internal engagements across the organization. Next slide. So contextualization, I mentioned community kind of aspect on the previous slide, but it's also so important to think about contextualization and localization, to really think about who and how to make the CBCM accessible and easy to use. Because if it's not accessible and if it's not easy to use, uptake will be low and all of your efforts and energy will be for naught. So it's important to do that background learning and assessing what are the different groups of who are the stakeholders who were aiming to CBCM to be used. They may prefer one mechanism over another. It's important to think about having multiple ways to report within the CBCM, and it's not just anchored on one way. So I've seen a lot of times where organizations will have just a hotline, and that could work for that context. But really thinking about, is a hotline suitable for this context, for this region, for this cohort that we're working with? Or if they're phone dependent and you have a hotline, and there aren't girls, for instance, don't have access to lots of mobile phones, then a hotline, the efficacy of a hotline is greatly reduced. So it's thinking about the different groups that you're targeting. How do we make those pathways accessible? What groups prefer one mechanism over another, and thinking about having a wide range of mechanisms to the extent possible. So that external contextualization and consultation is very, very important, and understanding how they want to report. What are their concerns? What is already existing? Are there any mechanisms that are already being utilized? And if so, can those be built on, or are those not well used and you need to create new ones? Communication channels and languages that affected populations like, but they don't like, their preferred methods, all should be the guiding force in terms of establishing a CBCM. And again, as I've said, understanding the reasons why individuals or groups may not report, and just understanding that in addition to reporting and what they would like, also what they don't want. So that gives you some very, very useful intelligence and data to inform the model and to ensure that it is effective. Next slide. The monitor and review of a CBCM is often so critical, so important, because it takes a lot of energy, it takes a lot of time to undertake these consultations, to devote capacity to establishing a CBCM. So you really want to make sure that you also leave capacity and there's enough thinking about how the CBCM is monitored, how it's used, and how that feedback is being used to inform any adaptations that might be necessary. So monitor and review can be looking at, how well are we responding appropriately to reports? How often are we responding in a timely way? Are things getting through to the right people after a concern has been raised? How does it work? And do we need to make any adjustments? Do we need to make changes? Are questions that need to be asked continually? There also needs to be a raising awareness with all members of the population around the CBCM's existence, how to use it, and encouraging use of it. The comms around it is very, very important, and that comms also needs to be highly contextual, highly relevant, so that people know that the CBCM is available and that they feel confident and safe to use it. There should be attempts to regularly ask and have feedback sessions on, is the CBCM fit for purpose? Does it need to be changed? Especially if reporting is low. You need to consider any adaptations I've said before, and consider if new channels are needed, particularly in times of a crisis or a humanitarian response. It's very important. No reports is not a good thing. I think sometimes organizations think, well, we have a CBCM, but we don't receive reports. That means everything is okay. And actually, that means that you need to do some further interrogation about why reporting is low. So we shouldn't be kind of assured by the fact that no reports are coming. It should be a basis to ask more questions about why it's not working and why uptake is low, and continue to think about ways that it needs to be adapted or amended. The last point about this is around sharing lessons and documentary learning. So whatever's coming through, whatever issues are being raised, it needs to really be kind of aggregated together and really looked at it from a learning perspective, so that you're improving service delivery, you're listening, and you're responding, and that the program or the service you're offering is strengthened because you're using the feedback and applying that learning to programming. Next slide. So what I've done here is I've just included a very brief outline of what a basic referral pathway could look like, or a CBCM could look like. Your organization may have something similar, it may be different, but these are just kind of outlining some basic steps in terms of what, from intake to decision-making and outcomes, what it could look like. But this by no means is exclusive. It just is trying to walk you through the key components. So essentially there needs to be a mechanism or multiple mechanisms for information to come into the CSO. And there needs to be an ability to triage what's come in, to really get to grips with the complaint or the concern, and whether it's a formal route or via an informal route, which means that it could come via an individual. So they may choose not to use a hotline or an email address. They may report to someone directly or verbally from the CSO. So even informal information still needs to come through the CBCM. So all staff need to be trained if they receive information to get it into the CBCM via the right route. And so essentially that's the first phase, is the intake phase, which is a kind of open door for concerns to come in. The next phase is around how the information gets managed and how it gets reviewed. Hopefully your safeguarding focal point team or individual will be at this step, because they are the trained individual on safeguarding who can really get to grips with what's come in, who's at risk, what support needs are indicated, and to really start the process of managing and handling that response in the right way. So that needs to be happening at the same time. So as soon as something comes in, the prioritization of a victim or survivor needs to happen in the first instance. And where necessary and in line with the needs and wishes of any victim or survivor, looking at safe referrals to appropriate services if that is indicated. So the safeguarding focal point has quite a significant role in that early phase. The next phase is around how the matter gets handled internally within the CSO. So it's looking at who needs to know within the CSO, depending on what's come in. There may be an investigation that may be needed, or it may not be required, or may not be indicated at that time. So within this phase, it's important to think about confidentiality and keeping your need to know group very small. And there also needs to be consideration of making an external report, perhaps to law enforcement. That is something that needs to be very, very kind of handled very carefully, very sensitively. There are issues in certain contexts, in certain countries with law enforcement. We want to ensure that we do no harm, but equally, by all means, where it's safe to do so, and where it's indicated via a risk assessment, which would be led by the safeguarding focal points, that referral should happen if it's safe to do so, as well as any other external referrals that need to be made in line with service mapping that hopefully has already been done as a result of this work. The third phase is around thinking about feedback and anonymous, doing that in an anonymous way that does not divulge or does not violate principles of confidentiality. So at the end of that matter, however it gets resolved, we hope that it's resolved safely with the well-being of everyone prioritized. There really needs to be some form of agreed feedback, safe feedback to whoever has made that report. Now, that may not be possible in all instances. It needs to be risk assessed, but a lot of times we hear of people who have raised the report via a CBM saying, I never heard anything back. I don't know what's happened with my concern. No one's come back to me. So it's a very sensitive issue, and that feedback needs to be managed carefully and sensitively, but where you can, and to the extent possible, trying to communicate some form of outcome to the person who has raised a concern is very important. And then the last piece, which is around collaborating with other NGOs, sharing lessons learned, doing that anonymously. So you're not divulging any sensitive data to other NGOs or CSOs, but aggregating larger learnings, lessons, because that can be shared with others for wider learning and coordination. So again, these are just some very, very basic steps. Your CBCM will have to be nuanced based on the issues that are live for you in your region and what's going on with your beneficiaries and what they need or service users. So this is just giving you some very, very basic steps of what a CBM could look like. So with that, I will hand over to my colleague, Seda, who will anchor some of our thinking anchoring this within an emergency and humanitarian response. Over to you, Seda.
Thank you very much, dear Andrea. From this point on, I will be actually talking why a community-based complaint mechanism is important at times of emergencies. I will also talk about some key points that could be taken away as best practices and considered while implementing a community-based complaint mechanism. A community-based complaint mechanism is CBCM, or sometimes it's also referred as a complaint feedback mechanism, CFM, is crucial in times of emergency for several reasons. And in the upcoming slides, I will be talking about these importances in details. But if I have to give a summary, I could say that it serves as a vital tool for ensuring effective response and recovery in the wake of various emergencies, such as natural disasters, public health crises, and other incidents. I also want to highlight the fact that although it's called a complaint mechanism, it's also important to consider that we can also receive feedbacks through the established system. So it's not only about the negative aspect, but also the positive feedbacks that could come within the program. Next slide, please. Thank you. So why is a community-based complaint mechanism, a CBCM, important at times of emergencies? Now I will actually go over some examples illustrating this importance in times of emergencies and how actually the feedback that we receive is essential to shape our programs and services. Although for this session, I'm saying at times of emergencies, it's also important to note that a community-based complaint mechanism is still very important and critical after post-emergency times, as it is the foundation for accountability. So some of the important aspects why we should have a community-based complaint mechanism is to ensure accountability. So by establishing a transparent feedback loop, a complaint mechanism holds organizations accountable for their actions and decisions. And this provides the affected populations with a mechanism to voice their concern, report issues, or seek redress. Further, it provides a rapid response. In emergencies, a timely feedback allows organizations or institutions to identify and address urgent issues swiftly, ensuring a more effective and efficient response. So taking action before a problem gets even more serious. So this is very critical. It's also important for identifying vulnerable populations. In emergencies, vulnerable populations such as the elderly, disabled, or those with limited access to information may require specific assistance. And the CBCM can help identify and prioritize the needs of these groups. Ensuring that the resources and support are reached to them in a timely and efficient manner. Then it's important, as CBCM is important for resource allocation and prioritization. So the feedbacks obtained through the complaint mechanism helps in prioritizing and allocating resources based on the most critical needs identified by the affected communities or the population. For example, in the aftermath of an earthquake, various factors must be considered to ensure that the right and appropriate resources are distributed and the most urgent needs are addressed promptly. For instance, if I have to give an example regarding this, last year after the earthquake, along with the financial assistance, people around Turkey were collecting essential items to be sent out to the southeastern part of Turkey. but there were so many assistance flooding into the region, and some of the assistance that were sent were not very useful to the affected community. For instance, summer clothes were sent out to the earthquake victims, and it's important to note that the earthquake happened last year around February 6th, so it was during the harsh cold winter. And when this was the case, the affected population were able to speak out for their needs through different feedbacks and complaints stating their dire needs. Because this was really critical, and receiving the needs of the affected communities through these kind of feedbacks and complaints actually ensured to take action through different organizations and institutions by their communication channels. So these organizations and institutions actually accentuated on the importance of the real needs of the communities, because there was a problem that people were sending out assistance that did not help the affected population directly. It was more like getting rid of the old or unnecessary items around their house. So it was really important in receiving these kind of feedbacks, in prioritizing the need of the affected population. Lastly, in this slide, another reason why we give this much of importance for community-based complaint mechanism is for preventing corruption and mismanagement. So in the case of an emergency, the potential for corruption and mismanagement of resources can increase a lot. And CBCMs provide a transparent and accountable means for the affected communities to ensure any irregularities or misuse of resources and help maintain integrity in the response process. Similar to my example that I have stated earlier, for instance, last year there were many reported cases in Turkey after the earthquake where individuals claimed to be part of an organization or institution, or it could be that those individuals could have been part of these organizations, wanted money in return of the humanitarian assistance that was provided to the earthquake victims. And when there is such a chaotic environment, it's really hard to depict this kind of corruption or mismanagement. But if there is an effective mechanism where the affected population can actually report these kind of concerns in form of a complaint, then an immediate action could be taken to stop such corruptions from happening or from taking place. Next slide, thank you. So continuing with the importance. Ensuring equity and inclusivity is another important point. CBCMs can highlight disparities and inequities in the distribution of aid or resources during an emergency. And through community feedback, authorities can actually better address these inequities and ensure that support reaches all segments of the population, so leaving no one behind in that aspect. So another important reasoning why we want to have a community-based complaint mechanism is the continuous improvement aspect. So regular feedback from the community helps organizations evaluate the effectiveness of their interventions, allowing for adjustments and improvements, and to enhance the overall impact of the emergency response. It's really important to note that taking or receiving complaints and feedback is an important aspect in trying to improve the standards and the quality of the program and the services that we provide. Then we have the community engagement aspect. So a CFM fosters direct communication between the organization and the affected communities by promoting community engagement, trust building, and a sense of ownership in the decision-making process. And when people feel heard in decision-making, they're more likely to take ownership of recovery efforts and work collaboratively with responders. That's why it's really important to ask and hear back from the affected communities on their thoughts about certain issues. Lastly, CBCM is important in preventing misinformation and rumors. During emergencies, misinformation and rumors can spread rapidly, and a CBCM can serve as a reliable source of accurate information and help dispel false rumors, ensuring that the community has access to trustworthy updates. So in summary, I can say that community-based complaint mechanisms are integral to emergency response and recovery efforts as they facilitate communication, accountability, equity, and trust between authorities, institutions, and affected communities with a more people-centered and efficient emergency response. Next slide, please. Thank you. Now I want to quickly delve into how the absence of a community-based complaint mechanism in emergency situations can have significant consequences and risks. So some of these risks, I could say, is the lack of timely information, the misallocation of resources, increased vulnerability of at-risk populations, fail to identify and address emerging needs, lack of accountability, ineffectual communication and coordination, spread of misinformation and rumors, diminished community resilience, and lastly, underreporting of critical issues. So next slide, please. Thank you. Until now, we talked about the importance of a CBCM. I actually want to now delve into why, like some of the best practices and the key aspects that could be considered while trying to establish a CBCM in times of emergencies, although it could also be very applicable for post-emergency situations as well. So it's really important to strengthen and establish a complaint and feedback mechanism. But when setting up a new mechanism, it's also important to analyze the operational context first, such as the existing feedback mechanisms, the available human, technological, and financial resources. Also do some operational risks and constraints that could be coming up with this mechanism that we want to set. It's also important to note that during times of emergency, it's really highly recommended that where possible to build on the existing capacities and avoiding duplicative or brand new systems, as it does take time and effort. So going with what we have already in hand is a key note in here. Even if we do go building a new brand community-based feedback mechanism, it's also important to take into consideration to actually identify and define the appropriate platforms for this community engagement. So how do we expect our affected communities to pose their complaint and feedback? Is it through a complaint box? Is it through the hotlines? Is it through online portals or community meeting? So it's really essential that we have these defined in a very clear and transparent manner. Secondly, it's really important to have this clear communication strategy to inform the affected populations about the existence and the purpose of the complaint and feedback mechanism, and through which medium do we want this communication strategy to be carried out. Is it through a hotline, text messaging, online platforms, printed materials, or verbally during service provision, depending on the community's preferences and available resources and technologies? So this is really important. And while defining actually these communication channels, it's really important to design and choose it in a user-friendly manner, considering the diverse needs of the community. So if we're doing it only through online platforms, this could result in excluding people who do not really have the social media literacy. So it's really important to choose a medium that would include, or mediums more than one, that would include the different diverse components of the affected community. And with this comes the importance of providing multilingual support. So in diverse communities, it's really essential to offer CBCM services in multiple languages to ensure that all members of the community can use the information provided, and they have access to the mechanism. For instance, in Turkey, after the earthquake, communication materials were prepared in Turkish and Arabic to address both the local Turkish people and the Syrian refugees living in the affected areas. There are also situations where other languages are used depending on, the refugee population living in that region, for instance, Farsi. Thirdly, it's really important to have this standardized data collection and recording system. So using consistent data collection and recording methods to document complaints and track their resolutions is really important to ensure accountability and transparency. And this data that could be acquired from this complaints and feedbacks could be valuable for future response planning and improvement. And with the standardized data collection and recording, it's also important to define the roles and responsibilities. So who will be taking in the complaints and who will be responsible in managing and, resolving these complaints that we take, the response time frames. So how do we get, so in what will be the time frame for urgent issues? What will be the time frame for non-urgent issues, non-urgent complaints? So these are some of the important things that should be laid down prior to setting up the system. And it's also important to ensure the privacy and confidentiality. So as humanitarian workers, we must guarantee the privacy and confidentiality of individuals reporting complaints. So anonymity should be an option, as this can encourage more people to come forward with their concerns or complaints. And lastly, for this slide, it's really important to sensitize and educate the community and the staff. So organizations and institutions should conduct capacity building and awareness sessions to inform the community about the existence and the purpose of a CBCM. So this includes explaining how to use the mechanism, the types of issues to report, the expected response, and the expected time frame regarding their complaint. Next slide, please. So lastly, we have two more points regarding some of the key points that could be taken into consideration while establishing a CBCM is establishing a feedback loop. So it's really important to commit to providing a feedback to the community regarding the status and the resolution of the reported issue. So this transparency fosters trust and shows the CBCM as genuinely responsive. It's not only taking in complaints, but actually informing the affected community about the outcome of their complaint. Also, with this comes the regularly updating contact information. So if we do not have the updated contact information of the affected population, we cannot really establish the feedback loop that we are talking about in here, because at the end of the day, we have to get back to the affected community regarding their complaint. So it's really important that these information are up to date. And lastly, we need to consider the continuous improvement aspect, continuously assessing and refining the CBCM based on feedback from the community and lessons from each response is really important for the program. So we have to adapt to changing circumstances and needs. And we have to also make the usage of the data and experiences gathered through the CBCM to advocate for any policy changes or improvement for the broader disaster response system. So in a nutshell, these are the minimum best practices that I can provide for the organizations for organizations while trying to establish or operate a CBCM effectively during disaster response as well as post-disaster situations. The goal is to actually ensure that affected communities have a voice, are heard, and can actively participate in the response efforts, leading to more efficient, accountable, and community-oriented disaster response. So that's all for my side. Thank you very much for listening. Back to you, Heather.
Thank you, Seda, and also thank you to you, Andrea, for providing us with such wonderful information and rich discussion. So we're opening the floor up to questions from our audience. Please write your questions in the chat, in the Q&A, and we'll be happy to address those with our panelists. Anyone has any follow-up questions, comments they want to make? Okay, we have one question coming in for Andrea. And this is, could you share some tips for establishing sustainable referral pathways?
Yes. Tips for establishing sustainable referral pathways. I think the most important when thinking about it's great. First of all, it's great that you are thinking about sustainability because I think oftentimes, there's just everyone's moving so quickly. Programs are, especially in the humanitarian response. But I think thinking through sustainability is great. So you need to think about sustainability from the very start. I think for me, it's the two components around the more that you can consult, not underestimating the importance of consultation to really ensure that you have sufficient data or intelligence from the community, from your organization. You really know your organization very well. You understand your capacity, the safeguarding technical capacity that you already have and what might be needed, and ensure that aligns with the system that you're trying to build. So I think doing the initial hard work at the beginning, just making sure that you have consulted, you have internally assessed capacity, ensures that the framework that you set up is going to last. So you're not just going and quickly, responding to and creating a pathway without taking the time to lay the groundwork and lay a strong foundation for that CBCM to be really, really effective. I think that is really important. I think looking at the types of referral pathways is also really, really important. There's no point in developing systems for a hotline when that is not going to work for the community. So I've seen too many times a lot of resource, a lot of time lost because that thought hadn't gone into what are the right structures that we need in this region with this population, and making sure it's really, really tailored and really, really thought through and well managed. So I think thinking about sustainability is an amazing question. It needs to be considered at the very beginning. And I would say, please don't underestimate the time that it takes at the beginning phase to really think through the construct of the model. And once you do that, I think it sets your CBCM, sets it up to be very effective and to be sustainable. Thanks.
Thank you very much, Andrea. We have a question for Seda. I think you can address this one. How can children be included in CBCMs? How do we make them child-friendly? How can we be accountable to our younger affected populations?
Well, that's a really good question. I have to say that in order to include the children and the younger generation into this complaint feedback mechanism, or the CBCM that we're talking about, it's really important to go creative in this sense. So going mainstream is not always the best option. So we cannot really impose the same mainstream CBCM modality to the children out there. So if we want to take complaints or feedback from the children or the younger population, from younger adults, we have to go for other mediums. So this could be, for instance, wish trees, or some other creative methods that could be used in form of art. So through like having sessions, having a dedicated person who would be actually conducting these artworks, sessions with these children in the communities. That could be in form of like a wishful butterfly or a wishful the tree. So it's really good to have that art and creative part blend in together, because we cannot really expect the children to just file a complaint into the complaint box. This is the adult version of the CBCM. So in the chat box, I see, what do we mean about the wish trees? I mean, like, I can say there are these, drawing or, laying out a tree on a wall and having these sticky notes with the complaints or the wishes or the feedback of the children. And this could be conducted in a very, gaming manner. It doesn't have to be in a very official manner where we expect the children to pose their complaints. But at least we can see what they don't like about the program with these kind of activities, what they wish the program or the services we provide could be improvised, as well as what we are doing good. And children are very honest in those kind of situations and moments. So bringing art, game, and creative aspect together would be a good and efficient way to gather some, thoughts and feedback from the children and the younger adults.
Can I just add to that, Heather? I think those are all amazing points. Thanks, Seda. And I think one thing that you can't underestimate with children is the trusted adult model. I mean, most children, in a lot of projects I've been involved in, we've asked children, we've done some kind of focus groups, and we've had child-friendly spaces, and they always have said, and most times they prefer to, if they're going to express a concern or share something, it's to a trusted adult. So I think you can't underestimate the power of well-trained staff and teaching staff or organizational staff who are in direct contact with children, always being mindful that at any moment children can disclose, and they may not disclose, the full nature of the concern. It might come in bits and pieces. So I think what Seda said is absolutely great. And I would also add, with children, not underestimating the importance of safe and trusted adults who work with children, who know how they communicate, and who know what to do with that information and how to support child in that moment and how to ensure that their concerns are escalated effectively. So I would also add that, as well as good comms and child-friendly messaging about encouraging children to express concerns as well. So yeah, thanks, Heather.
Thank you both. You've given some great recommendations and best practices for incorporating better methods for children and making it more inclusive. What about for participants and affected people who have disabilities? How can we make CBCMs more inclusive for them? And I'll direct this to Andrea.
Yes, yes. Same with people with disabilities. I think, again, it just goes back to consultation. It goes back to understanding, how best can they report. It's thinking about how to make sure those pathways are accessible. It always is. It could be whether it's visual impairments, physical impairments, whatever that the issue is. To the best of your ability, just making sure that those pathways are accessible and open. And if they aren't, it's about trying to have that. It goes back to consultation. I'm a really big fan, as I'm sure you can tell, about consultative and being collaborative in your approach. So if you have people with disabilities in your program services, or this is a part of what you do as an organization, hopefully you'll be able to build in sufficient consultation to ensure those pathways are disability inclusive. Seda, were you going to come in there?
Thank you so much. That was great. I just want to also add a point regarding informing the caretakers. Yes, to the maximum where we can, it's really important to include the disabled community within our CBCM, but it's also important to inform the caretakers on behalf of the disabled individuals that we would want to actually take into the system. So we would also, in a way, rely on them as well. And it's also important to do some adjustments in our CBCM. So like if we have disabled individuals within our affected communities, we should plan the complaint and feedback boxes accordingly. For instance, positioning them in a way that it could be reached out easily with a wheelchair, or so on and so forth, or ensuring that our services or the center is suitable for individuals who have eyesight disabilities or impairments. So it's really important to take into different consideration that the center is also suitable for a wheelchair, that it has the inclination and stuff. So these are some of the things that could also be considered and added on to what dear Andrea has said.
Thank you. So there are many things that each organization can do to make their CBCM more accessible and more inclusive to everyone. Thank you. We have a question that came in. Does every NGO need to have a CBCM, or is it enough to rely on larger inter-organizational methods? And I'll ask Seda.
So I think that, and I believe that every organization should have their own CBCM, because it's not enough to rely on a whole big mechanism out there, because that will require more collaboration and cooperation. And of course, this is something great, but at, in terms of accountability, we have to take urgent actions when necessary. So setting up this utopic CBCM for the whole could be harder to manage, having the roles and responsibilities, who will be the backup for a person who's away, those kind of critical aspects. So plus, a CBCM can come within a program about the programmatic aspects, some details within the program, or the service provision within a program. So I think these could be solved more on a programmatic level, with each organization having their own CBCM, rather than having the CBCM as a whole. But what could be done is that there could be this interagency coordination group where a a mutual CBCM could coexist. So every organization could have their own CBCM in with a parallel existence of mutual CBCM. So in this point, what could be done is organizations can share their best practices, some of the key takeaway points, some of the changing thoughts on how certain complaints are being handled and addressed. So it's more like a collaborative hub where every organization learns from each other. But when it comes to solving a complaint and handling a complaint, I think this should be on a programmatic level.
Thank you very much. I think we have time for just one or two more questions. Andrea, how would you recommend an organization deal with or handle working with a partner who has a system that just involves reporting any type of complaints to managers directly?
I'm sure that happens quite a lot. I think there's a couple of things there I would kind of recommend. I think there should be some capacity building with that partner on, the importance of establishing a proper feedback loop or mechanism between the partner and the CSO. That communication is really, really important. However, I know from experience that, despite the best systems in the world, people still choose to report directly make verbal reports to individuals within the program. So I think, you can, and that goes back to what we were talking about in the slides around formal and informal information coming through to an organization. So if everyone in the organization is trained, no matter whether it comes via formal or informal route at the head of programs level, it's still that head of programs knows what to do with that information. But I think additionally, there needs to be some capacity building with the partner around how to formally communicate these issues, what types of issues need to be reported, and how that communication will work across the handling of that incident. So I think it's a two-pronged approach that would work best in those types of scenarios.
Great, thank you. So unfortunately, that's all we have time for today. So thank you again to Andrea and to Seda for their informative presentations. And thank you to all of you for your engaging and challenging questions. Before we go, I'd like to share with you some especially valuable information. We have an exciting update. On our webpage, you can find comprehensive training modules for learning about safeguarding. This course is contextualized to the MENA region and consists of 5 learning modules that cover everything from creating safe programming, working with partners safely, receiving and responding to complaints, and monitoring and evaluation for safeguarding. The first 3 modules are now available in Turkish, which is very exciting. And of course, you can find all 5 modules in Arabic and English and a host of other languages. Please go online now and register for the courses. They are excellent. We'll also be sharing a few additional resources with you here. You can also find a wealth of information on our MENA Region Hub, full of resources and documents, guides, tips, tip sheets, how-to guides, great things there. We will be sharing a poll with you now. We are so grateful if you can complete it, as it helps us do better and tailor our services to suit your needs. And we will be sharing this webinar recording and slides to you shortly, as well as other related resources. If you want to hear more about future RSH webinars, subscribe to our newsletter. The link is in the chat. Thank you very much, and we hope to connect with you again soon. Thank you.